Hello friends, today we are going to discuss here about surgery MCQs. This is part 2 for NEET PG and NEET SS. Both exam this MCQs will helpful. Thoracic esophagus, blood supply by inferior thyroid, aorta and bronchial artery, inferior phrenic or left gastric. So the single best answer here is aorta and bronchial artery, that is bronchial artery. Length of D2, second part of duodenum is 2.5 centimeter, 5, 7.5 or 10. The best answer here is 7.5 centimeters. So these are the explanation. D2 extend from GB neck to lumbar vertebra. 4, it is retroperitoneal structure, and blood supply of esophagus is seen in thoracic by azygous vein, tracheobronchial arteries, and neck is by inferior thyroid artery, and abdomen part of esophagus is by left gastric artery, lateral and ventral, and splenic dorsal. Okay, now correct statement about Boerhaave syndrome is may present with peritonitis, forceful vomiting against open glottis, most common in upper 1/3 of esophagus. Most are managed conservatively. So the single best answer is may present with peritonitis. Okay. Most common diaphragmatic hernia in a newborn infant is Boerhaave, Morgagni, paraesophageal 1, paraesophageal 3. So answer here is A. Now, Boerhaave syndrome is a forceful vomiting against a closed glottis. Here in option they provide open glottis. The obstruction at both ends lead to perforation at weakest point in the lower esophagus, not in upper 1/3. The content mostly perforate in the mediastinum and pleural cavity, can cause peritonitis. Due to excess chemical irritation, there is a very limited role of conservative management. So hope this statement is clear. Boerhaave hernia comprises of 85% of congenital diaphragmatic hernias. 80% these are left-sided. Most are repaired in children. Congenital hernias develop because of incomplete embryological development of diaphragm. Morgagni hernia, retroesternal or Larry's hernia occur in a triangular shape between muscle fiber that makes up the diaphragm, extending from xiphisternum and costal cartilage to the central tendon of diaphragm. 90% are right-sided, as on the left pericardium prevents the herniation. Now, adenocarcinoma of esophagus is associated with which of the following? This is a gold standard MCQ, so many times, lot of exams they ask. Answer is Barrett's esophagus. Barrett's esophagus is a complication of GERD, and due to reflux there is a conversion of Barrett's esophagus, and this can lead to adenocarcinoma in future. GIST is gastrointestinal stromal tumor, is more than 10 centimeter. High risk cases. Imatinib therapy is for how much years? 1 year, 2 year, 3 year or 5 year? Answer is 3 years. Okay, answer is 3 years. Association of carcinoma esophagus is with a number of risk factors. Both squamous cell carcinoma and adenocarcinoma of esophagus have different etiology. Risk factor for adenocarcinoma are tobacco, GERD, obesity, achalasia, Barrett's, injury to esophagus, history of radiation for breast, previous radiation of carcinoma. Okay, now 3 years course after resection of high grade GIST. Imatinib has new adjuvant therapy in locally advanced GIST. Metastatic disease has restricted primary and high risk of recurrence indefinite. So guys, now gastric ulcer type 3 is located in lesser curvature, body of stomach, prepyloric, GE junction. Answer is prepyloric. What is Ogilev syndrome? Acute colonic pseudo obstruction or chronic colonic pseudo obstruction or fecal obstruction or intussusception? So Ogilev syndrome is acute colonic pseudo obstruction. Drug causing pancreatitis is L-asparginase, metronidazole, ciprofloxacin and penicillin. Very important, answer is L-asparginase. Okay, acute pseudo obstruction. Drug causes pancreatitis is corticosteroids, azathioprine, asparginase, valproic acid, thiazides, and estrogen. Double duct sign is seen in periampullary carcinoma, chronic pancreatitis, hepatocellular carcinoma, GB carcinoma. Answer is periampullary carcinoma. So guys, thank you for watching this video. If you like this video, put like on it. And if somebody is new on my channel, please subscribe this channel for more such videos and more such updates. Thank you.